If you are looking for the number one most important thing for you to do to help your heart health or prevent heart disease, or even in some cases, reverse heart disease, I'm going to share with you the thing that is critical for you to do, to invest time in. And that is to schedule an appointment with a cardiologist. And this is something that most individuals meet a cardiologist or their new cardiologist when they're in the hospital in the middle of a heart attack. And that is one of the most challenging, I think, scenarios of heart disease, is that most of us don't know, and we aren't involved in pre-screenings. So you go to your normal GP and you have your annual wellness checkup. Our heart health isn't front and center. And so it becomes necessary, especially if you have any family risks. Like my family, we have heart disease, that's a risk factor, and I'm on it. And a lot of my patients, I have them schedule and coordinate and find a cardiologist that they see every year. It's like a normal annual checkup. So it's just like your eye doctor, your dentist, your general practitioner, your OBGYN or your proctologist or your foot doctor. A cardiologist is a necessary annual visit. And really from 40 on, that's when you want to start going, because there are an assortment of tests and diagnostic tools, screening tools that can give you really powerful knowledge. You can find out, are you getting the beginnings of arterial blockage? Are they noticing any calcifications presenting? Are you noticing any of the beginnings of maybe heart arrhythmia? Are you beginning to have elevations in blood pressure, increase in heart rate? Those are all really important preventative things to have addressed, but most importantly, diagnostically assessed. Assessment is power, and this gives you knowledge and information to then make the necessary lifestyle changes, the dietary changes I'm discussing here this month, as well as adding supplementation that we have here at Organixx, and as well as other herbals and things that you can add in. But knowledge is really important, and pairing up with a cardiologist is critical. And this is where having this type of specialty is super important, because this is one thing, especially for ladies or gentlemen that have experienced hormonal imbalances. It's not uncommon for hormonal, like reproductive hormonal imbalance to present, let's say, elevations in testosterone or even decreases in testosterone. That directly influences your heart health. And if your OBGYN or your general practitioner or your prostate doctor, your urologist is identifying that you have an elevation in blood pressure, but is not making that connection that's testosterone or hormonal driven, your cardiologist does. They have a different type of expertise, and they have a different viewpoint in terms of how to keep you optimized. And at the end of the day, heart disease is the leading cause of death. Having a cardiologist in your arsenal, your toolbox of wellness resources, and having diagnostic tools every year gives you a baseline so that you also see if there are any abrupt, subtle changes occurring. You can be powerfully armed and equipped with the ability to make the necessary changes, decisions, and lifestyle changes to help optimize your wellness. So that's my recommendation. I really know that if you haven't seen a cardiologist ever, it'll be truly a life-changing experience. And if you haven't seen your cardiologist on an annual basis, call up and get that appointment. So that's my takeaway for you. Let us know how it goes. Let us know if there are any findings that you're really excited that they found that could be preventative and could actually save your life. I love hearing those stories. I know they're there, and I really hope you take this to heart.